He needs a vacation.
Yeah.
All right, thank you. All right, we'll go ahead to roll call. Jeannie?
Leonard Forsman, President.
Present.
Mel Sheldon, Jr., First Vice President. Delno Saluskin, Second Vice President. John George, Third Vice President. Jeannie Louie, Secretary, here. Sharon Gowdy, Treasurer.
Here.
All right. Taylor Alvick, Assistant Secretary.
Here.
And with that, we do have a quorum with 4 officers present.
All right, thank you very much. And we'll go ahead and get started with the agenda. And I'll turn it over to Terry to manage that. Thank you, Terry.
Okay, thank you. Good morning, everyone. We have a couple of adjustments to the agenda with the email going out this morning talking about the CARES Act distribution formula. Ron Allen will be speaking to that later this morning. And then Deb Holland and Tom Cole will be putting forth a piece of legislation tomorrow with regards to broadband, and they're seeking support from different organizations, including ATNI, and Jeff Blackwell, who chairs the NCAI subcommittee on telecommunications and technology. He will join us later as well. So we have those 2 additions to the agenda. And when Laura Platero comes on from the Health Board, joining her today will be Dr. Weiser. So if tribes have any questions for Dr. Weiser, they can ask him at that time as well. So we'll start off with Brian Gunn. Brian, if you want to go ahead. Good morning.
Good morning, Terry. Can you hear me okay?
Yes.
Okay, great. I'll make this brief, just given the adjustments to the agenda with Chairman Allen. Talking about the CARES Act notice. I'll just give the broad strokes of that and and refer all questions to Chairman Allen later. But this morning, I guess this is the big news. This morning, the Treasury Department issued a press release along with the Secretary of the Interior that beginning today, they will begin making $4.8 billion of the $8 billion in CARES Act relief funds available to tribal governments. So money will start flowing today, and it looks like it will be on a rolling basis over the next couple of days. And what it appears from this press release, and the caveat here is that you know, when you look at the details of this, it raises questions that have yet to be sorted out. But just from their press release, it appears that the 4.8 billion that will be going out to tribal governments, that amount will be based on population data used in the Indian Housing Block Grant formula. And again, questions there are multiple formulas. Which one are they using? I mean, we don't know at this point, but that this 4.8 billion will be based on population data, and there'll be a floor payment of $100,000. So the other part of the press release talks about that the remaining 40% of this money of the CARES Act funds that I guess isn't being distributed beginning today, but will be, is going to be based on data based on employment data, essentially, that they intend to collect, and sort of what that data looks like. What will be required, again, unclear from this press release, but the big picture is that money will start going out today to tribal governments. It's also clear that they are holding back payments to Alaska Native corporations pending, I guess, resolution of these issues in the ongoing cases challenging the inclusion of ANCs. But yeah, so significant news, and at least some money will be starting to flow today. Again, as I mentioned, a number of questions about this. I was just on this NAFOA call where various folks were drilling into this, asking questions that that I don't think any of us know quite yet, but we should be learning those in the coming days. And this material is on Treasury's website. Also, they updated their FAQ document for state, local, and tribal governments relating to the expenditures and the uses of the relief funds. That is also on the Treasury website. I haven't been able to go through the entire thing, but there are some, it looks like, significant additions to that. One of which is, it talks about, in the previous guidance, it mentioned that one of the permissible uses would be for a government to provide grants to small businesses who incurred interruptions because of COVID-19. And it provides a little bit more meat to that. And I think it does, at least in my mind, just looking up the FAQ on that issue, it looks like it did clarify, to the extent there was any confusion, that tribes would be able to transfer money to tribal enterprises who were impacted under certain conditions. So I encourage folks to look at that. I think, or I assume, that the national orgs will probably skull together some kind of at least informal guidance for tribes to follow. I think the one certainty here is that for these types of things, you want to be part of the herd, not a lone wolf, for lack of a better way of putting it. So I would look to NAFO and NCI on guidance on what they think the tribes should do to implement these programs. But that's really the big news, Terry. Again, I don't want to steal Chairman Allen's thunder on some of the specifics of this later in the agenda, but that's really all I have.
Are there any questions for Brian?
Yeah, this is Taylor. I was wondering, is there Treasury still thinking about appealing that court decision at all? Are they done with that?
This is Brian. I mean, I guess I don't know. I know there are other folks on the call here who are parties to the litigation that might have more insight. But at least from the publicly available documents, it's unclear. All you can deduce from what's been filed is that they're still haven't made a final decision on that issue.
Hang on, Brian, just one moment. Okay, I was just checking the chat box. But if there's no other questions for Brian, we'll move on. Thanks, Brian. Thanks for providing that information.
Thank you, Terry.
Update. Okay. And next up is Laura Platero from the Portland Area Indian Health Board, and joining her will be Dr. Weiser. Good morning, Laura. Dr. Weiser.
Good morning, everyone. I'll just, before I let Dr. Weiser answer any questions that you might have, I just wanted to give an update on the data that we have. And so IHS Tribal and Urban Indian Facilities are reporting data to IHS. On top of that, we've been able to collect, in terms of the tests that are taking place at our ITU clinics, we're also collecting data on tests that were the test results of facilities outside of the ITU system. And so we have a total of 210 cases in the Portland area, 19 in Idaho, 49 in Oregon, and 142 in Washington. And so I just wanted to give you the latest information. Just as a reminder, we continue to have our 10 a.m. tribal calls, and then we're doing echo clinics, which are basically an opportunity for providers to ask questions. Usually there's a panel of some experts on those calls. We've done some on traditional healing. Those are recorded and available, and they are Monday and Wednesday at noon. So in terms of who's on them changes changes somewhat week to week, and Dr. Weiser is actually involved in those. But I really wanted to give you the opportunity to talk and ask questions to Dr. Weiser, who has been really closely tracking the antibody tests. And I know Chairman Forsman, you had a question about testing strategies and some of the issues you've been experiencing. So Dr. or maybe Terry, I don't know if you want to just let folks ask questions or have Dr. Weiser maybe give an update on antibody tests, since I know that's a really important question everyone's had.
Sure, let's go ahead and do that.
Dr. Weiser?
Hi, so this is Dr. Weiser, and I just need to preface anything I say in that Laura asked me yesterday afternoon if I could be here to talk to you. And so because of that, I didn't ask permission to be able to talk to you. So this is just me doing a favor for a friend rather than officially representing Indian Health Service, because otherwise I would have to have asked permission, and that would take several days. So please just keep that in mind. Basic comments about testing are, right now, we're really relying clinically on the virus testing. So that's the PCR test that we've been doing for several weeks now, and the newer Abbott ID Now test, which is similar to PCR, uses a different technique, but it still is able to detect the virus or even parts of the virus. And so those are the two main tests that we're doing right now clinically. And
Excuse
then,
me, what was the second test name?
It's the Abbott ID, that's the brand, and it's a nucleic acid amplification test.
That just tells you whether you have it or not, correct?
That's correct. And then there's some problem there with, in the recovery period, those tests can be positive for a longer time than someone might feel ill. And it's not clear that those tests are detecting whole virus that is infectious to someone else, or whether it's just detecting particles of the virus. So if someone has recovered fully in symptoms from the virus, but they may still be testing positive 3 or 4 weeks later, that's probably just, we could think of that as a false positive, where it's detecting virus particles, not whole infectious virus. It's still unclear during that recovery phase what that positive test means, especially if someone's completely resolved their symptoms, feeling fine, and it's maybe persisting to be positive for 2 or 3 weeks. The recommendation from CDC for saying when someone can be released from isolation, there are 2 ways to do it. One is based on their symptoms, and the other is based on having 2 negative tests in a row. What we're recommending is that we primarily focus on those symptoms and the time, rather than on having everyone do 2 tests in a row to determine that they're negative. The time-based strategy is 7 days after the onset of symptoms, and 72 hours after the last fever, and over those past 72 hours, you're getting better. In other words, your cough is getting better, your energy is getting better, everything's getting better. If all those things are met, then we're saying that you no longer are sick or infectious with COVID-19, and you can be released from isolation. So I'll say that again. So someone who has been diagnosed with COVID-19, and it's been 7 days since they got sick, since the onset of symptoms, and at least 72 hours since they've had any kind of fever without taking fever medication, and other symptoms that they've had are all getting better. If someone meets all 3 of those criteria, we're saying they've recovered and they can be discontinued from their isolation. The alternative to that is that they meet all those criteria and have 2 tests that are negative 24 hours apart. And what we found is difficulty in getting that 2 test negative, because sometimes a PCR will still be positive and the Abbott will be negative, or the PCR is negative and the Abbott is positive. And again, those tests at that period of time, when someone's fully recovered, we can't tell if it's detecting a whole virus or just the part of the virus that it's designed to detect. And that can happen because as you recover, your body is recovering, it's getting rid of the dead cells from the lung, and in those dead cells will be some of the virus particles, but not necessarily the whole virus that makes you infectious to other people. So before I talk about antibodies, is there any other question about that kind of testing? Okay, hearing none. So antibodies are what your body's immune system makes in response to an infection. And I think we're probably most familiar with thinking about the HIV test. So if someone gets an HIV test, testing for HIV, they're really testing for HIV antibodies, the evidence that someone has been infected in the past with that virus. And so the antibody test for COVID-19, you can think of it in a similar way. There are 2 kinds of antibodies. One comes up within the first week of infection, and it reaches its peak by about the 2nd week, and then it goes down, and it becomes undetectable by about 6 weeks. That's called IgM. So that's the antibody that your body first makes that tries to help you get over that infection in the very beginning phases. The second antibody is IgG. And IgG starts to rise during the 2nd week of the infection. It reaches its peak by about week 6, and then it goes down a little bit, but it generally stays positive for a long time. The IgG is that sort of memory response that would tell us that this person, we can test it, farther out, and it'll tell us that this person had coronavirus. There's a lot of questions we don't know about those antibodies. We don't know if they protect someone from getting infected again. We don't know how long those antibodies last, particularly the IgG. It may last just for a few weeks or a few months. It may last for years. We don't know. And we can't say from those antibody tests with any certainty that someone is immune and can go back to work and not have to worry about getting infected again. All of those things are unknown.
If I might ask, this is Ron Allen,
Sure.
So I guess the question is, with that testing equipment, we can have a better handle on how many people in our region or area was infected, not just the ones who are infected that we know through Abbott and other testing that's out there. So there's a value there, as opposed to just whether or not whether or not you have the antibodies to protect yourself from the consequences of the virus.
Yes, that's absolutely right.
So that helps us contain it in our respective areas.
Yeah, it helps us to understand how widespread the infection was in our region and in our communities. And it also helps us if we do those kinds of surveys over time, we can see, how quickly that's going up. If there's ongoing infections happening and more people are getting those antibodies formed. And so CDC is working on doing what they call seroprevalence surveys. And that's where they will work with states and other regions to collect samples of blood for the antibody testing. And they haven't really published anything on the website that I've seen to describe in detail how they plan to do that. Are they going to use blood that's already been collected from hospitals when people are in the hospital and they're getting blood drawn for anything else? Will they be taking samples of that blood at random? Will they be sampling blood donations to Red Cross and samples of that blood at random? It's not clear how they're going to be doing that or where they're going to be doing that. The states are also probably interested in doing something like that and maybe working with CDC to develop those sero surveys. And finally, in Oregon, the Oregon Health Authority is partnering with OHSU to enroll 100,000 people in an ongoing survey over a year where those people will be monitoring their temperature daily and their symptoms daily. And if they have temperature or symptoms, then I think they're going to be testing them with that PCR test that I talked about first. And about 10,000 people from that 100,000 will be randomly selected. And I think those people will have the antibody testing done. They're still working out the details on that survey as well. But that's the only one so far that I've seen any of the details published. And you can find that at the OHSU online or Oregon Health Authority. Both have links to that study. But I'm not sure right now in Washington or in Idaho or other states what the actual plan is for doing antibody prevalence testing. From the clinical standpoint, as a clinician in the clinic, it doesn't help me too much to get an antibody test on somebody other than it tells me that, yeah, they had coronavirus some time ago, but it doesn't tell me that they have it right now and doesn't help me with any decision making I need to do for that patient right now.
Well, wait a minute. If the test shows that they had it, you could easily do a quick test to determine when that they have it currently, correct?
Right. So if someone has a antibody test where the IgM is positive, that usually gets detected. The best results are at about 15 days. So 15 days is when they should already be getting better, if not fully better. So unless they're, so if they were sick, they probably would have had an antigen test, PCR or the Abbott test prior to that 15 days when the IgM is going to be at its maximum and most likely to be detected. So we're not recommending to clinicians right now that they do antibody testing because the antibodies rise later than the actual acute infection and really outside of the window of when they should be experiencing symptoms and even be already recovered.
Well, isn't a bigger question, do we even have a sufficient supplies and testing equipment for the antibody in the Northwest?
That's a good question, and I don't know the answer to that. There are over 150 antibody tests on the market. There are, as of yesterday, 12 that have actually submitted data to the FDA and received an emergency use authorization. And that's the authorization that says FDA has reviewed this test and is allowing it to be marketed or used. It's not approval by FDA because that process takes over a year to get validation studies done to tell whether the test is any good. And to be honest, that's the current situation with all of the testing for coronavirus right now. Even the PCR test and the Abbott test, they're being used under emergency use authorization. And so we don't have very good data on whether these tests are any good or not.
Are we going to get more Abbott machines?
I have not heard that there's going to be more Abbott machines distributed to HHS. As you know, Abbott and HHS had a partnership, and HHS distributed those machines directly to states and to IHS. So IHS received 250 of those machines to deploy across the whole country. And we received initially 17 of those machines, and we deployed those according to the restrictions that they gave us, which was they had to be in rural areas, and initially for sites that had laboratories that were medium or high complexity. And secondarily, then we could open up to those labs that could do CLIA wave testing.
This is Leonard here. I know that the need for test kits as far as our our county here in Kitsap near across from Seattle had a report, and I know this is probably very similar to everywhere else in the Northwest, that there's obviously a shortage of test kits, and that there's counties in the state of Washington that have requested test kits, and they've had their requests in for a month and they're unfulfilled. So there's obviously a big pent up demand for this. It's really being portrayed as the solution or the holy grail for getting the economy going again, fairly or not. I think that's a whole nother discussion, but I think it's going to help. So I know that Indian country is going to want to help ourselves and perhaps our neighbors try to get more test kits into our regions, because we rely on a strong economy, of course, throughout, because most of us have enterprises as well. So I don't know if I necessarily asking a question there, but just kind of confirming to you that there is this need. However, our county told us that they have a bunch of kits left over from a testing site that they set up for a while, but they said they're the ones nobody wants. They're like the third best out of the three. So your discussion about the test quality varying is also very accurate. So thank you.
Sure, and I'll just say that I know that Washington has a lot of the swabs in the viral transport medium, and they've identified a supplier, a domestic supplier, I think in Washington supplier actually. They had gotten some of these, like several thousand of these from another supplier, and they turned out to not be any good. And so they had to recall all those, and that might have caused some transient shortages, but they should be pretty flush right now at the state with those testing swabs and the viral transport medium for doing PCR testing. And so I think maybe just reaching out to the state again to find out what the status of those supplies is might be helpful. And that probably then that would also imply that it doesn't require that you have to send those tests to the state public health lab to have those run. I think if you get those supplies from the state, you can send them to any reference lab that you might be using, whether it's LabCorp or Quest or Northwest Labs. And my understanding is that these labs also now have plenty of capacity in some labs, especially if they're not your usual go-to for laboratory testing. You might look to see if you can set up a new contract or an additional contract where you can send labs, specimens to these other labs to have them tested. Northwest Labs in particular, I think, is offering a pretty good turnaround time of a couple of days, maybe 1 or 2 days, which could be faster than your current lab that you're using. The Abbott ID Now test kits, I think we probably have a few more weeks left of the HHS contract, where sites that receive those machines from IHS or from HHS will be automatically getting their test kits renewed or refilled based on the usage and based on reporting. So if you have one of those machines and you're not keeping up with the reporting and you're not getting replacements, it's because you're not reporting. And so that is one of the requirements for those machines, is reporting the number of tests daily. And then that is used to determine how many more test kits to send out. That's why they're asking for that reporting. At some point that will stop, and supposedly the test kits for the Abbott ID Now will be available on the market, and then folks will have to be purchasing them on the market. But I don't have any details on the timeline for that. I can find out from our logistics officer and let Laura know.
Well, I agree with Leonard that on the first hand, we're concerned about the adequacy of testing equipment and supplies that allows us to know what is going on in our area, so that we can feel comfortable and safe about moving our economies forward and opening up our businesses again. So it's of great concern to us. We just need to make sure that we work with Laura and in terms of supplies that's out there, the IHS, in terms of Abbott machines and even the antibiotic testing equipment is relevant to the big picture. As this effort gets deeper into summer, becomes more and more alarming for all of us.
I have a question. This is Kat Brigham with the Umatilla tribe, and I know, we're all kind of in the same boat in that we don't have the supplies. We're trying to figure out what's best for our health of our community. And one of the things we're doing is we're developing our own, trying to establish our own database. And so my question is, if tribes were to develop their own database to determine whether we should move forward with an economic plan to reopen, and that's what we're doing, is, we're going to be basing it on the health of our community before we do a reopening. But at the same time, getting those supplies and getting those tests are going to be really important. And as you said, there's a big time shortage. So would it help if all of us developed our own plan to do a database or establish a database? I'm just asking.
Kat, were you directing that to me or to the other folks on the call?
I'm asking you because
Okay.
the supplies depend on you guys getting us the supplies. And so I'm trying, to implement our plan, we're going to need the supplies. And so I'm asking if each of us developed a database plan, would that be helpful or not?
I agree with what you said, that having enough tests and supplies is going to be critical to the decisions you make. In addition to that, having the ability to investigate cases, new cases, and meaning, interview them, find out where they've been, who they've been with, who their contacts are, and then be able to reach out and make contact with each of their contacts and identify anyone there who might have symptoms or have had close contact and also need to be tested. That's the kind of activity that I think would really make it a lot safer for things to go forward. And where we, if we don't have that ability either within our tribe or in collaboration with our local health jurisdiction, then it would be really hard to be able to know with any certainty that you can contain any new outbreak in your community. So we need that testing, we need those testing supplies, absolutely. And we need the trained staff to be able to do the contact investigation as well. So it's not just knowing the test, but also knowing what to do with those when people do test positive. And as we begin opening up, the biggest fear is that we'll see little hotspots, hopefully little hotspots of cases and transmission in places where maybe we didn't know it was happening or didn't expect it to be happening. We need to be able to jump on those right away and help contain those. It's very similar to like fighting wildfires and in that mop-up phase. Sorry.
Okay. I guess you still didn't answer my questions, and that is all part of our plan. But I guess out of the 57 tribes and ATNIs, let's just say 50 of us have a plan. that says, we're doing exactly what you said. Is that going to make us top of the priority because we have a plan to do testing, establish that database for the Pacific Northwest so that we can get the supplies needed to do the testing that we want to do to determine when we can reopen?
So regarding the database, I'm not clear on that, but if you're talking about having a place where you can put those test results and tracking how many people you tested, how many were negative, how many were positive, how many had follow-up and were given isolation and were, met the criteria to be released from isolation, how many of the contacts were put on quarantine, and how many of those stayed on quarantine for 14 days, that kind of information in a database. Yeah, I think that would be really helpful for each tribe to be able to do. And if you were to put that all together, then that could be something that could be helpful for the region. And then who can help with that? The health board has staff who I think might be able to contribute to that kind of effort, either in the planning or other technical assistance. And I will let Laura speak to that, whether the health board would be able to be the, on behalf of the tribes, create that database and hold it for you and provide reports from that database to you, because I'm not going to commit the health board to doing something like that.
Thank you, Dr. Weiser. And so we are happy to talk about that further. I could ask our epicenter director to be on another ATNI call in the future, or we could set up something separately to talk about what you're proposing and how the health board can assist with that. We are ramping up right now our staff capacity for contact tracing. We already have some staff trained, but we're actually ramping up our capacity to be able to provide even more assistance to tribes. So we're happy to coordinate a meeting specifically on that topic.
So Laura, this is Ron. I just threw out a question on the chat. There's 750 million for testing that's supposed to be coming from, I don't know if it's HHS, HRSA, or who. But they're supposed to be distributed. Are you tracking it, or is Dr. Weiser tracking it, so we would know when those resources are coming out?
Sure, Sarah is tracking it, and she keeps track of all of, Ron, I don't know if you've seen, we do a funding chart and have done with all the packages, and she's been tracking like when the funds become released, when there's tribal consultation on them, when the funding announcement is posted. And I've shared that with Terry, and it's been a really good resource with that. So I haven't heard anything yet about the 750, but that doesn't mean there hasn't been some discussion yet. I will check with Sarah on that, and then I can email Terry if there's some update that I'm not aware of.
Yeah, I know you're going to go on your own call in a few minutes here, so you make sure you ask that question. I won't be covering that one, but somebody on our staff will.
Okay, yeah, I'll ask Sarah to cover that on our call at 10, and then follow back up with you.
Yeah, because it's not on your current. I just looked at your current list. It's not on there.
Okay, yeah, she just probably hasn't added it yet, so I'll check with her on that and then follow back up.
Okay.
Thank you.
Yeah, I
Laura.
think, go ahead. I think, Terry, the suggestion about maybe having one meeting just to discuss this issue for tribal leaders would be good, because it's kind of hard to follow.
Yeah.
But the thing is, it's like I heard this morning on the news, there was an expert who says, well, this is very gray still. So the experts don't really even know. So as tribal leaders, we want to be experts on everything. But when the experts aren't experts, and they're still they're flowing through. I think that it'd be helpful for us to get the more, and there's more information coming out every day. But it'd be good for us to get a feel for that, because all of us are facing this, because not only do we have our own, tribal members and people who live in our respective lands, but we also have the surrounding community that we're trying to integrate with. And one statement I had that was interesting from a state senator yesterday from our district said to the county commissioners who sit on the public health board, it said the public health board has now become the economic development district for Kitsap County. So I thought that was an interesting discussion coming from state senate. So this is something to think about, but I think, Terry, we probably should talk offline about getting something like that together. So thank you.
And I'll work with Laura on that.
Okay.
Okay, thank you, Laura, and thank you, Dr. Weiser, for being with us today.
Thank
My
you.
pleasure. Thank you. Good luck.
Last week, Chairman Stensgar from Coeur d'Alene was on the call and talked about the reopening of the casino at Coeur d'Alene. And Jeannie Louie is also on the line with us today, and just wondering if either one of them want to provide or are ready to provide just a brief overview of their grand opening over the weekend.
Ernie, are you there? This is Jeannie. I wasn't, or I didn't attend the grand opening, but I understand that it was overflowing with customers, and everything seemed to go well. The patrons were lined outside of the casino, and as they entered the casino, they were temperature checked by our Mariman Health Clinic staff and given masks if they didn't have their own masks, and then were allowed to go ahead and go into the casino. And everything, as far as I know, or reports that I've heard from the CEO, everything seemed to have gone well. There was bingo was also held, and they had safe distancing there. Our machines were turned off, every other machine, and everything seemed to go perfectly well, as far as that I understood. We had our staff member out there at the opening so she could do the take pictures for our archives, since this is a something that doesn't happen, you know, all the time, and reopening our casino was quite an adventure. And good luck to everyone else that's opening theirs.
Well, Kalispell is, I think today, Jeannie.
Yeah, yep.
Is your hotel open?
Yes, it is. Packed, full capacity. Yep.
Thank you, Jeannie.
Have you seen any Suquamish Clearwater Casino cards?
Actually, my husband Deb said he was sitting by a fellow at the machines, and he said he was from the Clearwater Casino. He said, "You mean way over the island over in Washington?" And he said, "Yep, this is Suquamish."
Oh no! Yeah, he rode over with the guy from Jamestown.
Yeah, please honor those cards.
A lot of Washington State plates.
Okay, thank you, Jeannie. And then I know, as Ron said, Kalispell Northern Quest is opening today, and then my understanding is the Spokane Tribe Casino is opening next week. And one further note on that is, as you may already know, NIGA has put out reopening guidance. We had invited Sequoia Simmermeyer to be with us today. Unfortunately, he had something else on his schedule, so we'll try and get him on next week. But there was a Dear Tribal Leader sent out with the guidance, and we can get that potentially sent out or posted. Moving on.
Terry, I thought that Coeur d'Alene was opening up one or more of their casinos. Not Coeur d'Alene, I'm sorry, Colville.
That one I haven't heard. Do you know, Jeannie?
I think they're waiting until the end of May.
Okay, they changed their mind. Huh.
Yeah.
Okay.
Real quick, Jeannie, is Idaho in general under any sort of stay-at-home order now, or are they pretty much opening up, or that status statewide?
No, I believe it opened up here on the 4th or the 5th.
Any other questions? Okay, as I mentioned previously, with us today is Jeff Blackwell. Jeff co-chairs the NCAI subcommittee on telecommunications and technology, and he is going to share with us today a piece of legislation that Deb Holland and Tom Cole will be introducing tomorrow, and they are looking for support from the tribes on this, and should we decide we want to support them, we need to get back to them by 2 p.m. today. So thank you for being with us, Jeff, and go ahead.
Thanks, Jay Chukma. It's an honor to be invited. I hope you can hear me okay.
Yeah.
I'm one of those telecom propeller heads. You see it right above my head right here. Many people know that I'm from Oklahoma and New Mexico, but not many people know that I'm also a proud card-carrying member of many of the casinos in the Pacific Northwest. So I'll have to spread my play around next time I'm up there.
Well, we're well aware.
It's those penny slots. It's those penny. But I have, and thank you very much to Terry, Chairman Forsman, for inviting us. My co-counsel with the NCAI Technology and Telecommunications Subcommittee is on the call as well, Matthew Rantanen. I also have the honor of chairing the Economic Finance and Community Development Committee at NCAI, and NCAI has endorsed this legislation. The bill is set to be introduced. Deb Holland's office has written it. Tom Cole, a Republican from Oklahoma and a Chickasaw, is also supporting the bill. We expect that it'll be introduced on Thursday. It is called the COVID Disaster in Indian Country Bill, and that stands for designation of immediate special authority of spectrum for tribes' emergency response in Indian country. The bill does not have a number yet, but it is been circulated with the Native American caucus in the House, and we expect that there are several offices that will be signing on. So both Matt and I provided technical expertise and helped with input into this bill. It essentially does two things. It identifies areas of spectrum for tribal nations and for the Department of Hawaiian Homelands, and it has a very discrete definition of Indian country to avoid the previous concerns around the third tranche of money. But the first thing that it does is it identifies areas of spectrum where the FCC is authorized and directed to initiate special temporary authority licenses for tribal nations under their 10-day rule. And I'll throw it to Matt in a minute to talk about those areas of spectrum, because it is more than just the current 2.5 gigahertz that the FCC is currently licensing under a tribal priority window. Many of you may know that the National Congress of American Indians and their members of Congress, including these two members of Congress, Holland and Cole, that have asked the FCC to extend that window for those 2.5 gigahertz licenses until next January. But this bill is designed to authorize the licenses and provide funding for the construction of temporary networks. So the first is that special temporary authority for spectrum. The second element of this bill identifies $300 million that will go into the Community Facilities Program at the Department of Agriculture. It is money that is targeted to be funded directly to tribal nations, not necessarily run through the industries. 297 plus of that, 297,500,000 for grants under the Community Facilities Program for qualifying tribal entities to create special temporary networks, temporary broadband networks, and also to include important elements of that, like backhaul costs and repairs that would be more expeditious and more cost efficient than building a new network. We're aware that there are a number of places out there in Indian country that, but for repair, there are communities that can be connected. The act also authorizes $3 million in grants to the Community Facilities Technical Assistance and Training Program for tribal nations, for intertribal government associations like ATNI, and tribal serving institutions at universities and colleges to provide training and technical assistance for the purposes herein. I think it's important for folks to know that the timing of this, right now under the act, the timing for the applications would be a 6-month window in between enactment of this, and then those special temporary licenses would operate for 6 months. The FCC has a process that this basically lifts and borrows from, but prioritizes this amount of money and this training opportunity and expedites it for Indian country. I want to make sure, since there's a lot of technical expertise in the ATNI region, I want to make sure that folks know that we did share this, of course, with the folks in your telecommunications and utilities subcommittee, or committee, excuse me, and it presents an opportunity for as many tribal nations as this funding will cover. I want to make sure to share, to ask Matt to mention in these, at a high level, to talk about this type of spectrum, because this type of spectrum we identified working with some other spectrum experts to make sure that this is robust. So Matt, I want to throw it to you for a second.
Sure. Hello, everyone. So I think, long story short on this, it's the spectrum that's available to use that has a light license or an affiliation with being registered, but not really truly licensed. It gives us opportunities to deploy broadband networks in an emergency scenario and a long-term scenario, moving forward. And it is valuable spectrum to be able to do communications during this time. It's asked for a little bit of restriction release, as well as sort of speeding up process on any other impediments or barriers that exist in the system. But this spectrum that's been asked for, you can see the list in there, really allows you to deploy a communications network at a fairly rapid rate during these circumstances. And we're looking to basically make it as easy as possible with this to be able to go out and stand up some communications or repair existing broken scenarios and use microwave to bypass problems, to be able to do things like Wi-Fi drive-ins, which are parking lots that are, hot Wi-Fi spots that everybody can drive in and access during COVID-19. So, the consideration and then in consultation with a couple of folks was to make sure that we were addressing spectrum that was outside of the unlicensed space, which we already have access to, but into that lightly licensed scenario that could be very functional to do this at a rapid pace. So, thank you.
Okay, well, so you have an ask for us today?
Yes, President Forsen, it's our recommendation from the NCAI Technology and Telecommunications Subcommittee that ATNI consider signing on to this piece of legislation and recommending that their tribal nations do as well. The National Congress of American Indians submitted their support this morning. There are a number of tribal nations, tribal colleges,
Right.
Native Public Media, the Association of all the tribal radio stations signed on earlier.
Right.
I think it's important to understand that, you know, right now nationally, the dialogue is that in one of the things that got left out of that third tranche is broadband. And broadband, never before in the 20 years that I've been involved has my phone rung more, because people are beginning to understand the real challenge and pain of the digital divide, how it exacerbates everything that's going on in any country.
Right.
This provides both the platform and the funding. And the important thing I think to recall is that, you know, there's virtually nothing in any country that gets built that's truly temporary. I mean, the towers, the infrastructure that this will build, and that's going to change from tribe to tribe. It's still going to be there after this is over. So thank you. We're happy to answer any questions you may have, sir.
Okay. I would like to, Terry, do you think we're ready to direct staff to get a letter from the board? Or do we need to get something written and then come back?
Pardon me, I was on mute. It doesn't even have to be a letter there. They have a brief survey. Do you want to sign on? And Jane,
Yeah. Is there a motion from the board to support this legislation?
This is Sharon. I so move.
Is there a second?
This is Taylor.
Second, this is Jeannie.
Okay. All right. We have a motion from Sharon, second from Taylor. Support the broadband legislation. Any discussion? I did have one quick statement. Is I know that there's tribes out there that are struggling, and I just hope that the bill will allow to do a really thorough survey, so that there's tribes out there that absolutely are being left out. There's some out in the Northwest. You know, some of us that are in, you know, populated areas, most of us have pretty good access. We have to pay for it, but at least we have access. There are parts of the reservation here that are, you know, left out too, and I think that goes for everybody. We do have people in scattered areas. I don't want to get into a huge discussion because we're in a time crunch here, but I think that it's very important that we get, because the thing is, you won't hear from as vigorously from those people that are under-resourced because they can't even get on to be part of these meetings. So you need to make sure people get out in the field and figure out what they need and get it done. Because a lot of times I think these funding opportunities get out there and they have a meeting and they say, well, those people aren't showing, you got to get out there. So very important that this really have that type of outreach. Okay, with that, we'll go ahead and have the question called. All those in favor on the board say aye.
Aye.
Opposed, no.
Aye.
Abstentions, motion carries. Okay, we'll go ahead and sign on to that. Appreciate that, Jeff.
Thank you.
Thank you,
I'd like
Matthew, as well.
Thank you
to
very much.
ask a question
Go ahead,
here
Ron.
for Jeff. Shifting to the cell coverage, Jeff, I'm not sure if you have some insights or guidance for those of us who have built a tower. I mean, I have a dead zone right where my tribal campus is at, so we built the cell tower. It cost us $400 grand, but we are having a hell of a time getting Verizon, AT&T, T-Mobile, etc., in getting a contract to put their equipment on the tower. I don't know what to do here to try to force them. Is there any techniques or leverage that you know of to help make that happen?
Matt, it looks like you want to bite at this one first.
Yeah, just a quick bite at this. Ron, have you guys applied for the 2.5 gigahertz license yet? Tribal priority window for the
I ran that by our guy, and he thought that it wasn't relevant to us. I can't remember why, Matthew.
Okay, so let's just make sure that that you actually have available spectrum over your tribe, because some of it has been allocated and can't be used.
Oh, I know what you're talking about, and the answer is no, we don't. in our area.
You don't have any.
It might have been built
No.
out.
Okay, because I was going to say that would be one leverage point with T-Mobile and Sprint. If you had 2.5 gigahertz, they want it. So if you had it, you could leverage them in on that piece. But if it's already allocated and you don't have access to it, then we'll have to come up with another tack there. Jeff, go ahead.
So there are a couple of different methods to research all of the available spectrum. The FCC has a spectrum dashboard. I participated in the team that helped build that. It turns into a bit of a deep dive, so we may need to follow up directly with your tribe. That is a type of inquiry that can take all sorts of different directions. It's not always just a Verizon or a T-Mobile. Sometimes it's a license holder that is like in this 2.5 gigahertz. It's universities. So it's a really particularized inquiry. And there are methods to propose essentially something that is sort of rebroadcasting or franchising or sharing or subletting. There are lots of options out there. It turns into a technical inquiry that has a bit of a business model associated with it.
Okay, we're gonna have to connect up on that later. I've got a highly technical solution for you, Ron. You just got to build a taller tower.
But Chairman Forsman, I do want to.
We got to wrap up. We got to wrap up. Go ahead.
I do want to make sure folks know that we're also tracking other broadband legislation. You mentioned that there are tribes that do have coverage, but it's just a matter of cost. There are folks in the civil rights community that are lobbying the Hill right now for an increase in the household subsidies to be able to afford connectivity. It's called the Lifeline program, and one of their proposals is to double the subsidy amount per tribal household, and that would mean, we know that we have multiple families that are living within multiple households within a home. So as those things develop, we'll be happy to coordinate with your team and your staff, and if we need to come back on to make you aware of new opportunities, we'd be happy to do that. Thanks for the time.
Good, thank you.
I'll circle back to you guys.
All right, who's next, Terry?
Well, I want to hear Matthew say goodbye just because he's got such an amazing background.
Yeah.
Yeah. Looks like he's in a rocket.
I was envying that.
He's about to hit light speed.
Hyperspeed.
Okay, we will move on here and we will go to Ron. Ron, can you give us an update on the press release of the treasurer?
Brian did a great job of summarizing it this morning, and I don't think I need to add too much more. There was, when I was on the forward meeting or conference call this morning with Brian and others, there are some outstanding questions about the 60%. There's some questions out there still on that. Is 100,000 a base, and then there's an adjustment to the base, or is 100,000 just a floor? So we won't know that until the numbers come out and they actually reveal the actual model that they used on the HUD population base. But 40% on the economic development factor on the use of the W-3 forms, which reveals the number of employees we all have. That's a different metric and a different base, which will affect tribes differently because of their economic base. It asks for, it says that they have to confirm or they have to still acquire certain information, and we're not sure exactly what that is. So I know that I don't know if Tulalip is on the line or not, but they and Chehalis, et cetera, they were all making a case that there's no reason why that the second distribution based on what data they have right now couldn't be made. So we don't know that yet. So there's still, I know that NCAI and NAFOA, we're going to do some additional investigation along with many of our lawyer lobbyists. So that's really where we are. I think that it'll be interesting to see if any of our tribes receive money today or tomorrow. It's going to move fast because it's in the portal, so it's easy to transfer that money out of DC Treasury straight to our accounts.
Any questions? I have one, Ron. How should I feel about this?
Well, the large population-based tribes should fare well in this situation. Remember now, 75% of the tribes are in the 1,500 to 2,000, 1,500 range and lower. So it will be interesting once we see the results, how the 4.8 billion gets spread out. We won't know that till they actually reveal the full list of 574 tribes in their allocation. So I'm sure everybody's going to look at it to see how well the smaller tribes, if I can put it that way, tribes, 5,000, 3,000, or less than 1,000, how well they fare. So we're not going to know the answer to that question, Leonard, until we see the actual distribution list.
Are you surprised by the amount they held in reserve? I think about a lot of these Alaska tribes are going to probably be, they say it's $100,000 base. And so a lot of those Alaska tribes probably won't get very much, the smaller ones. And then I don't know who they're holding out for there.
Actually, this is an interesting one because the majority of the Alaskan tribes are small bases and small numbers. Clinton and Haida might be the exception to them, but the majority of them are small, and they have small bases like 100,000, 200,000. So 100,000 for them will be a nice bump. But the question of the day is how they're going to treat their number of employees, and that will vary from tribe to tribe up there. So it's a much lower number than the ANCSA numbers, because the ANCSA numbers is where they have, those corporations is where they have large numbers of employees. And the concern there is that they would be double dipping because they're counting the same citizens. Treasury has said that they're not going to let them duplicate and double dip. So we have no idea how they're treating the ANCSA corporations, because the citizens are actually in the tribes, not as well as in the corporations. And not everybody is a shareholder in the corporation. So it's very complicated up there in Alaska. So we'll see what happens on that end. But I guess what I was surprised, I thought the population base would have been smaller, and then the number of employees would have been a larger percentage. I would have suspected they would have reversed it. 40% population base and 60% employee base would have been more proportional to the actual impact to the tribes based on their on the COVID crisis impact. But they made the call.
Hey, Ron, this is Taylor. Is there a lot of restrictions with these funds? Is there very much self-determination in the tribes in regards to how those funds get expended?
Say that again, Taylor.
Yeah, I'm just wondering the restrictions or the red tape tied to the money to the tribes.
No, that was something Brian brought up this morning. There's a new F&Q for coronavirus funds that came out. It basically, when you read through it, it's about 6 pages long, 7 pages long. It gives the tribes a lot of discretion. And what we've been saying is it's very important for our accounting offices to be very careful about how you're documenting how you spend that money. And so you're not duplicating it. But for the most part, it's going to end up being self-certified like the states. But you will still want to make sure that you have a special code in your accounting for how you use those monies, salaries and rent costs, utilities and whatever. Or if you use some of it for GWE activities, that's in your GWE codes. You want to make sure that it even has its own special code. If you're giving money to elders or helping with utility costs, etc.
Any other questions for Ron? Or I think Brian is still on, or Brian regarding the disbursement formula? Okay, before we move on, I just want to let you know that James has posted in the chat box the FAQ and the press release from Treasury, as well as the broadband information that Jeff was talking about. And also Amber has put some information in there about SBA opened economic injury disaster loan portal yesterday for agriculture business impacted by COVID-19, and the SBA lists aquaculture as a business that is eligible, and she's suggesting that fishermen and women should act fast if they want to apply. And James has also included in the chat box the endorsement for the broadband legislation if you want to sign on as a tribe, as an individual tribe. But Kevin, are you with us? Kevin was going to join us. I'm not sure what happened to him. I'm not seeing him on. So he was going to, add to what he was trying to get a letter out within 24 hours, Ron. And who was he trying to get a letter out to, or NCAA trying to get a letter out to? They were talking about it on the NAFOA call this morning.
A letter for what?
I'm not sure. I was in and out of that call, so I knew Kevin had been talking about getting a letter out within 24 hours. I don't know if it was to Treasury about, I don't know.
Oh, the 8 billion. They had a number of questions that was not quite clear on the distribution of the 8 billion and how they calculated it. And the floor, it was a little ambiguous when you read the notice that came out of Treasury. So there was a number of questions. I think that they were going to respond to that, as well as urge the second distribution not to wait for the court case on ANCs to work its way through. Many of us suspect that ANCs will appeal, so it will go into the appellate court back there. That pushes it out another 30 days plus. So anyhow, I think the letter was relative to those two factors.
Okay. Okay,
I
so
don't see him either. I don't think he's on.
no. So
That's okay. We can move on.
and the only other thing we had on the agenda before some of this other information popped up was state updates, but I don't know if Kat's still on. Kat, is there anything new going on in Oregon with regards to the Oregon tribes?
No, well, actually, they said, we submitted an application to get some state funds, but at the same time, these funds are CARES funds. And so I don't know. I know we didn't. I don't know if anybody of the other Oregon tribes have submitted anything, but we're still trying to work with them to figure out how they can provided some additional funds without all the restrictions.
Hmm. Okay, then, Catherine?
I take it back. Also, as you guys know, Gary George is on the economic committee, and we are working on reopening plans, and they've opened the door up to all 9 tribes. And so last week we did participate in a call with the governor's staff on ideas for reopening, but at the same time, nothing really firm come from it other than we all want to be working together, and the reopening is going to be based on health versus politics.
Good point. I see the UROC Council is on. UROC, do you have any information you'd like to share from Northern California? Okay, I guess not. Catherine Edwards is with us. Catherine, is there anything new from Alaska that you'd like to share?
Well, Ron is an expert on Alaska, obviously. Talking about the agencies and the shareholders and stuff. So, of course, that's still a big discussion up there. Some of the villages, some of our northern villages one of them is underwater, and some of them are getting ready to go underwater. And then I appreciate the conversation about broadband, because some of our villages in Southeast are, even one of the people on our council are having a really difficult time being able to be in contact with the rest of us. So, and as far as the size of the tribes in Alaska, we know that they're small. The $100,000, like you said, may be a bump, but I don't know if it's going to, I don't know how much help it will be when your village is going underwater. So, and yeah, the stuff with the ANCs, it occurred to me the other day thinking about, maybe for the rest of you guys to know, is that they don't employ a lot of people in Alaska. A lot of their employees are elsewhere. And not all shareholders are tribal citizens. So again, we're still waiting for those outcomes. But that's what, and we have, Juneau has had no new cases, but we've had a couple of new cases in our region in some of the villages. So that's where we're at.
Okay, thank you. With just a couple minutes left, Amber, do you want to give a shout out to that SBA and the aquaculture availability?
Hey, Terry, can you hear me?
Yes.
Yeah, I just wanted to make sure that people were aware of it, and you had just announced it after I placed it on the chat box. So that's as much as I know. If anybody has any questions, I did add those links. It's not sure that individual fishermen are going to be eligible, but they shouldn't wait around to find out. So
Amber, I've got a question. But I know that should apply to all those of us who have oyster farms and hatcheries like ours. We have a hatchery, shellfish hatchery. But there was a case that I need to try to track down that affects all shellfish farms in Washington State. Are you tracking that at all? That with regard to the permits that for those farms, and that it basically was going to shut them all down, all of the commercial oyster farms that are out there.
no, Ron, that's not on my radar, but definitely one that we should be in front of. So I'll see what I can find out.
Okay, thank you. Because That's not necessarily a COVID related one. It's relative to a suit in terms of how all those farms, including ours, got permits, to engage. And I guess part of that question is, does it apply to the tribes versus the non-Indian commercial? So anyhow, if you find out anything on a future updates, I appreciate it.
Okay, will do.
Okay, Leonard, I think that's it.
Okay, well, thanks everyone. I know everybody's got other calls to get to. Thank you for participation. I think a few things came out, and the board's going to probably need to talk about possibly having some committee-like calls. So instead of we're at a mid-year or an annual or annual conference, winter conference, we would have these discussions within our committees. So something we may have to think about doing and then reporting out to a larger group. So we'll be working on that in the absence of a mid-year. We may have to think through that. So with that,
I have a question, Leonard.
Go ahead, Ron.
So since you canceled the mid-year at Siletz, what's the game plan for the mid-year for ATNI?
We postponed it till next year. So we have not really developed a plan for having a virtual conference yet. Terry, I don't know if you've thought through that yet.
We do plan to conduct a virtual convention, Ron. It will be minimized. It will not be the 3.5 days. It will be a much smaller time frame. And however, NICWA and NAFOA both conducted virtual conferences. And so James is in touch with those two organizations to figure out how we need to get set up. Fortunately, we don't have to reinvent the wheel. So he's in touch with those people right now, or representatives from those two organizations, on how to best do this. But so James is working on it as we speak.
Okay, I did, one of my staff participated in the fall. She told me it went really well. So until we can meet personally, we need to keep dealing with our issues. So I'm assuming you're going to let us know if and when you're going to schedule a conference.
Yes, the executive board gave us a time frame. So we're not sticking to the same dates, but they did allow us a time frame for approximately the end of May through the end of June. So that's our window we're going to schedule in there, but we'll let you know as soon as we can get something determined.
All right, well, with that, we are adjourned, and we'll be meeting again very soon, I'm sure.
All right, see you guys.
Thank you. Oh, go ahead. Bye.
Yeah.
Bye.
Bye.